are going to start breast. Okay, see what is breast. It is a modified apocrine sweat gland. It is a modified apocrine sweat gland. Now we are going to see the diagram of breast. We can call it the extension of breast. अगर हम extension की बात करें तो it starts from the second rib to the sixth rib. This is our sixth rib. And in breast we have a nipple that lies in the fourth rib. Fine. So it is a part where breast lies. Here breast rests. This is the pectoral fascia. We have two muscles, that is pectoralis major and one minor. Here we have serratus anterior muscle. What is this? Serratus anterior muscle. So now for us the important part is surgical extension of the breast. Surgical extension of the breast. अगर हम इसकी बात करें, so we have a diagram here like this. We will draw. This is the sternum lies here. Okay, this is a clavicle we have. We will draw the breast. This is a nipple and this is the breast. So this is the axillary line. See, what will be the surgical extent? If we talk about the superior, see, superior is the inferior border of the clavicle. What is it? Inferior border of clavicle. Lateral, what we have anterior. This is a, from here to here we draw anterior axillary line. It starts from the axilla to the groin region. So lateral is the anterior axillary line and inferior we have the intramammary fold. And our medial, this is a medial part. We have lateral border of sternum. So these are the boundaries. This is a clavicle, this is a sternum, this is the axillary line, and this is the intermammary fold. So this is the superior part, lateral part, medial part, and inferior. I hope surgical extent is clear. Now, again we will draw a diagram. That is this extension. This is the sternum, this is the clavicle, and this extent. From here we draw a mid-axillary line. We will give the name that this is the anterior part, this is the posterior axillary line, and this is the mid-axillary line. Clear? Next, in breast we have two parts, that is glandular part and stromal part. Glandular part means it acts on secretion glands. Glands lies here, so they produce a secretion. Stroma. What stroma does? Stroma means the structures which provide support. Fine. So that breast is divided into two parts, glandular and stroma. Glandular acts on secretion, stroma which provides support. Now, more structures include, see, we will draw this. Two lines, glands, again a line, and further are divided into branches containing billets. What we will mark numbering 1, 2, 3, 4. It is the easiest way to learn the diagram. So first is a terminal duct. Terminal duct. 2 is a lactiferous ampulla. Lactiferous ampulla. 3 is the major lactiferous duct. 4 is the minor, and 5th, we are confused between alveoli, lobule, and lobe. See, all they are the fifth part. What does it mean? That alveoli बनाती हैं lobule and lobule form lobe. So once again I will repeat. First part is a what? Terminal duct. It gives rise to lactiferous duct, major lactiferous duct, minor lactiferous ducts, and alveoli, lobule, lobe. Fine. Now what TDLU? TDLU. This is a terminal ductal lobular unit. If we asked what is TDLU, these are the various ducts we have studied. So how many number of TDLU lies in breast? It is 5 to 9. And number of lobules in breast, that is 10 to 100 per breast. So this is the TDLU unit of breast. The number of TDLU units in breast is 5 to 9 and lobules 10 to 100. Now, we have studied what stroma means. Stroma is the structures which provide support to the breast. Fine. So it is formed by two components, that is adipose tissue and Cooper's ligament. Cooper's ligament. Adipose tissue is the fat which is contained in the breast, which is present in the breast. What is Cooper's ligament? See, it's important, and these are also okay. Cooper's ligament, they are also known as Ashley's suspensory ligament of Cooper. This is another name we will have in NEET PG exam. And now if we ask the attachment of Cooper's ligament anterior, it is attached to skin, posterior to the pectoral fascia. Fine. Okay. Now a word comes. What is dimpling? What dimpling means? See, this is the breast, and tumor or a lipoma kind thing happens. Then if the breast like shrink inside, it is known as dimpling. The indrawing of the skin towards the skin अंदर हो जाती है. Okay, क्यों? Due to infiltration of Cooper's ligament. Fine. That is important what dimpling means. Okay. Now in next video we will study about breast lymphatics. It is an important question usually comes. Thank you.